Hey guys, today I'm going to talk to you guys about Accutane, why you would want to get on it, what the benefits are, what some of the side effects are, and then just answer some common questions I get in clinic all the time. If you have any questions, by all means, put them in the comments below. Per usual though, with most physicians, we can't dispense medical advice on social media sites. We can answer some generic questions, but if you have any specific questions, see your local board certified dermatologist to answer your questions and then maybe even get you on some Accutane. All right, let's get started. So Accutane, as it once was called in a branded form, is generically called isotretinoin, comes in different names like Clarivis, Absorica, Myorsin. It is a derivative of vitamin A that your body basically recognizes because it's used to getting vitamin A in your conventional diet, but it's a derivative. So it's what vitamin A breaks down into. You cannot get this in excess by taking vitamin A supplements or taking a lot of foods that have a lot of vitamin A, only because it needs to be something that's regulated, because vitamin A stays stored in your body. So if you are not being supervised by a board certified dermatologist, you will find that you could be causing yourself some harmful side effects. To get started on Accutane, you have to see someone that's registered with the iPledge program, which is a regulatory program administered by the FDA that started in 2005 because patients were getting pregnant on this medication. I'll discuss those side effects about pregnancy and medication here in a bit. But basically, you can go onto the iPledgeprogram.com website, find someone that's registered with Accutane. All board certified dermatologists are usually registered with iPledge, so if you see one of them, you should be able to get started on this medication. Accutane is very safe. It's been around since the 70s. It gained FDA approval in the 80s, so it is something that has been around for a very long time, and we know the side effects pretty specifically because of its length of use. So Accutane is indicated for nodulocystic acne, which are those deep cysts that come kind of underneath your skin, or acne that's been resistant to treatment, whether it be topical or oral, or scarring acne. This diagram here shows the variations of the different types of acne. So you can see in all of the different types of acne, there's a hair follicle with a sebaceous gland, which is kind of that leaf-looking structure hanging on the right side of the hair. So from left to right, you see basically what would be forming either a white head or a black head. In the second photo to that, you see a white head on the left and a black head on the right. Then to the right of that, you see what your normal kind of red bumpy pimple would look like. And then to the right of that would be a cyst. Those little red dots represent the bacteria that we know, P. acnes, to cause acne. And you can see it's kind of invading the sebaceous gland. The way Accutane works is it has multiple mechanisms of action, but in essence, it shrinks the sebum, which is the oil that comes out of your sebaceous gland there on the picture. So it shrinks the sebaceous gland, reducing the sebum, which basically gives that bacteria that possibly causing your type of acne to be reduced. So basically is semi-anti-inflammatory because it's reducing the inflammatory reaction and then minimizing the acne cascade that can effectively happen. So what's going to happen when you go see your dermatologist? They're going to assess your acne, see what kind of acne you have based on what we just described before, the variations of comedones, papules, pustules, or cysts, based on what type of acne you have and the potential for scarring, and then the severity being mild, moderate, or severe. They'll decide if Accutane isotretinoin is indicated for you. So now let's say you're a female trying to start Accutane that day. You wouldn't be able to start that day. You would have to take a pregnancy test in office that day or through blood work and return in a month to get started. You have to have 2 negative pregnancy tests to be started, and it's due to this iPledge program you can see here by the FDA. So you'll get a booklet that looks like this screenshot here that makes you review all the potential side effects. If you're a male, that visit, you would get started that day. You still have to enroll in iPledge and basically go through all the paperwork, but yours is a little less strict than with females. So females would have to be on 2 forms of birth control. So that'd be abstinence, male latex condoms, birth control, IUD. Males have to take a separate booklet. So for them, they just basically have to sign that they're not going to share their medications with females. Once we assess that you may be a good Accutane patient based off your clinical picture, we'll now take a better medical history to see if you can be a good Accutane patient to start the iPledge program. We'll ask you your psychiatric history, past history of depression. So basically, I firmly believe that some acne patients have a history of depression based on the acne itself. But I like to assess, are they on medications for their depression? Do they even feel depressed? If they are, I'd like to get their psychiatrist and therapist involved. Go ahead and give me clearance, and then also just have multiple people touching base with you. That way we all are in the loop and you feel you have open lines of communication. We'll talk about your forms of birth control if you're a female, going over those pretty firmly. Then we'll discuss the things you can't do on Accutane and then go over the side effects. So some of the things you cannot do while you're on Accutane. You cannot tan while you're on Accutane because Accutane makes you more sun sensitive. You can't donate blood while you're on Accutane just because the medicine will be in your bloodstream and you may give that to a childbearing female and that'll affect their potential for a healthy baby. You do not want to wax when you're on Accutane because your sebaceous glands are being shrunk, and those are what usually help the healing process. So if they are not fully functioning, they will not be able to help the healing while you're on Accutane. You do not want to mix it with tetracycline antibiotics like doxycycline and minocycline, which we conventionally give for acne. So you want to make sure that you're not double dipping and trying to do both because you're in a rush to clear up your acne. You also cannot drink while you're on Accutane just because alcohol is metabolized in the liver and so is the Accutane. So it's putting a larger strain on the liver. You also want to be kind of careful about how you eat. You want to take your Accutane with something fatty. So healthy fats would be peanut butter or an avocado, or you can eat it with your meal, which usually have fats, but you don't want to be eating, junk food every day and going through the fast food lane at Burger King, breakfast, lunch, and dinner, just because Accutane has been known to increase the triglycerides. So we don't need a double whammy of that happening. So what are the main side effects I tell my patients to experience? You will be dry. And actually, we kind of want you to be a little dry because that way we know, 1, you're taking the medicine, and 2, it's actually working to do what we expect it to do. So we don't mind when your lips are a little chapped. That's sort of a sign to us that your body is processing the medication well. You may have joint pain. I say it usually happens in people that are athletic or are harsh on their joints or have repetitive movements. You may get headaches, so we don't really want that. You may have night vision issues, which we will always ask you about. We will ask every single time you come about any change in mood, like mood swings, irritability, depression. These are the main concerns we will always keep asking you about. So the visits will get pretty monotonous because we're going to ask repetitive questions each time. If you're a female, you can't get pregnant when you're on this medicine, which we sort of alluded to in the prior sort of statements, because you have to be on birth control. So you have to be on birth control or some form of contraception throughout the entire treatment plan, which can range anywhere from 4 to 6 months. And you have to be on it for a month after stopping the Accutane because the medication basically stays in your body. And we can say that it's mostly excreted a month after stopping the medication. The question comes up, can males that are on Accutane basically impregnate their partner? It's hard to give a concrete answer on that and pretty much always tell them to discuss it with their OB, but for the most part, we give them the green light because there's no data to conclude that it's teratogenic, which means dangerous to the baby, as it is when the female themselves are actually taking the medication. So how we dose the Accutane is weight-based. The whole goal is to get a certain amount of medication in a certain period based on your weight. So that can range, depending on what literature you read, anywhere from 0.5 milligrams per kilogram all the way up to 2 milligrams per kilogram. But basically, we base it on your clinical symptoms, if you're dry again, and then the cumulative dose that's accepted in standard literature. We start you sort of on a lower dose just to get you eased to it, and then hopefully minimize that purging process that can happen in that first month, which we can expect to get worse before it gets better. The total time frame that I make my patients expect to be on it is anywhere from 5 to 6 months, and that's based on what we can tolerate getting into your body in that much time, based on your symptoms and how your acne wants to respond to us. So after each visit, after we go through a whole review of systems with you with the Accutane, and we go ahead and give you the next dose, every time you leave that office, you'll have to go on the I Pledge program, confirm that you were counseled and educated. That step has to be done so that the pharmacist can basically dispense your medicine to you. If that step isn't done, they will not be able to dispense the medicine. Lab monitoring is becoming more of a gray zone in recent literature. It used to be that we had to check it monthly. Some physicians still elect to do that, and that is safe, and some elect to check the labs when they feel there's symptoms that make them concerned, or they just have a calendar of when they check it, like the end of the first month, third month, and end of fifth month, etc. The medication comes in these foil sleeves you'll see here. A little hard to get out of there, so sometimes I encourage patients to just do it all in one sitting, get it out and pop it into a bottle. But then you have to worry that someone in your household may open those medications. It's of childbearing potential. But if you live in a very uninvolved house without any childbearing females, then I encourage it just to make it easy for you. That way you don't miss taking your medications. Accutane is a very safe medication when administered in the right hands. With monthly monitoring, you can guarantee that basically it's safer than some of these other medications that we dispense without the monthly monitoring. The main thing is, do not get pregnant while you're on this. If you start to have any mood changes, let your physician know. Let your family members know, just let someone know. Be careful in the sun, wear your sunscreen when you're on this medication. Moisturize, moisturize, moisturize. Use anything you can to help protect those lips. We usually recommend petroleum jelly. Otherwise, get ready for your acne to respond. The overall success rate is variable depending on the type of acne you have. Literature is variable on this as well. I tell people there's about a 50% chance that this will be gone forever. And then it also is by definition of what you consider clinically clear. On that last visit, when we see you at the end of those 5 to 6 months, I usually prescribe a topical to have on board so that you have something to sort of maintain the results of the Accutane. But for the most part, most of my patients seem to not use it, forget, or use it and stay clinically clear. If you have any questions that I didn't address, please leave them in the comments below. I hope this helped you decide if you should go on the Accutane journey. It's a great, great medication. I hope it encourages you to seek it out. No one should have to suffer with acne if they don't want to. It is something that this world should not have to see. So by all means, if you've been debating it, suffer no more. Get on the Accutane, fix your face, enjoy your life. Take care.